And has managed to join us today. We appreciate your time and your sacrifice. With us today, champions who have been traveling all over the world and advocating for vaccine equity. As you know, nurses and midwives are integral for vaccine equity because they're at the forefront of delivering vaccines. So we understand that all of you are very important as equal for attain vaccine equity. To start us off, I would want to welcome Rafiat.
Hello, everyone. Yes, hello, everyone. It's a pleasure being here. My name is Rafiat Akinyokun. I am an immunization advocacy champion with the National Challenge and the Sabin Vaccine Institute. I welcome you all to our session. It's nice to have you all here. So we've all been talking about immunization advocacy champions and the National Global Solutions Initiative. And a lot of people have been asking who the immunization advocacy champions are and what do they do. So I'll be taking us on who we are and what we do, what we have been doing for the past 1 year for being an immunization advocacy champion with the National Challenge and Sabin Vaccine. Like I said, my name is Rafiat, and I am from Nigeria. I'm a registered nurse midwife who has been working on vaccine hesitancy in indigenous populations in Nigeria. Over the past 1 year, I have had various discussions with stakeholders. We have held various webinars to talk about the need to improve the voices of nurses and to be able to talk about achieving vaccine equity and immunization in various communities, both at the local, national, and global level. Currently, I was at the WISH Summit to further advocate for the need for nurses, for the need to empower nurses to be able to talk about immunization and also empower their skills to achieve vaccine equity. I have other colleagues who are also immunization advocates champions from various countries. There's Rose Nakame. Rose just had our introduction. Rose is from Uganda, and she has been on the forefront of training nurses on the power of storytelling. Storytelling is an important tool that nurses need to use to advocate for improved healthcare wherever they are, not just about immunization, but whatever advocacy we have to achieve. Because the more you tell your story, the better people understand your challenges, and the better they are also able to, relate with whatever you do. So she has been on the forefront of training nurses through our organization, Remy East Africa, on the use of storytelling in improving vaccine equity. We also have Rashid. Rashid is an immunization advocacy champion from sorry about the break. Rashid is an immunization advocacy champion from Malawi. He has been on the forefront of improving vaccine equity and access in hard to reach communities in Malawi. We also have Umpo Shelile. Umpo is a lecturer and also an immunization advocacy champion who has been championing the training of nurses to improve their access to vaccination, and also to improve their skills in storytelling to achieve vaccine equity wherever they find themselves. We have Muhammad. Muhammad is from Sudan, also an immunization advocacy champion who has been on the forefront of negotiating with key leaders involved in immunization in Sudan. He has been involved with various heads of departments and heads of organizations involved in immunization and vaccination in his community, both at the local and national level. And we have Amy. Amy is a registered nurse from the United States. She has been on the forefront of interacting with various nurses, both in the clinical and non-clinical space, to improve their skills and also to improve their voices in trying to advocate for improved vaccine access and equity. So we have so many, we are all here and we have been doing amazingly well with whatever we do in our various countries. And I'm so pleased to introduce all of our immunization advocacy champions to you. And I hope that you all join us in our efforts to improve vaccine equity and access, both in our local and our national level. Thank you very much, Rose.
Thank you so much, Rafiat, for introducing us, giving a really beautiful introduction to all our attendees. As you've heard from Rafiat, we are only 5, but we recognize the 195 countries. So we need more advocates to join us to be able to achieve across the group. And all of you who are listening and all of you who might be able to listen to this recording or might not be able even to listen and hear from word of mouth, might want to join us. And if you want to join us, we want to welcome you with open arms, because your time as midwives, it's your time to be at the forefront, but also to be celebrated in your work and to be supported as advocates for vaccine equity. Thank you, Rafiat, and to our next immunization champion, we shall go to Amy Stanley from the United States. Sorry about that. And Amy Stanley will tell us about what you need to know about the Nursing Now Challenge Global Solutions Initiative. Thank you so much.
Thank you so much, Rose. I couldn't have said it better myself. We welcome all of you with open arms, and thank you so much for joining us. Some people spend their entire lifetimes working, hoping that somehow they've made a difference somewhere along the way. Nurses and healthcare advocates live every single day knowing that they have. Our 6 voices have traveled from a Zoom room to the ICN Congress, the White House, the United Nations General Assembly, the WISH Summit in Qatar, and to rooms that we haven't even entered yet ourselves. If you've ever dreamed about the impact that your voice could have, congratulations, because you've come to the right room. In the addition to the decline of COVID-19 vaccines, routine immunizations, including childhood vaccination rates, have rapidly decreased. In 2021, 25 million infants missed out on life-saving vaccines. This is the largest sustained decline in childhood immunizations in approximately 30 years. For every challenge lies a solution which has yet to be heard. Our solution to this challenge is you. Nursing Now Global Solutions Initiatives provides nurses and midwives with the opportunity to connect, share experiences, and develop innovative solutions to ongoing health challenges. For this initiative, we are challenging nurses and midwives to be an advocate of your own by developing a plan to engage or advocate in your community, country, or region for better support for health workers and other professionals by working to boost and sustain vaccine uptake. 6 individuals will be selected as winners and granted both a monetary prize to bring your plan to life, as well as a professional storytelling course by the amazing People Power Health to amplify your voice. Politicians have recently announced their investments in primary care, vaccine distribution, and health equity. We know that in order to achieve these goals, investments need to be made in the world's most trusted profession, nursing. We hope that you'll visit the Nursing Now webpage to read more about this initiative and begin developing your application. If you have any questions, please feel welcome to reach out to all of us at any time. Thank you again for having the bravery to bring your voice to this room. We're holding open the door, making room, and we look forward to meeting each of you.
Thank you, Amy. As you know, we can never do it alone, but joint efforts enable us to create change wherever we want to see it. This group of immunization advocates that I belong to and I proudly call friends, we have grown together to be able to advocate not only in our regions, but on a global scale. And in doing so, we have met other champions and met other coalitions and people who matter in this space to be able to advance this cause. As Nancy Ami can tell you, she has met with Jacqueline Chiari, who is the regional program manager of AMREF, advancing pandemic preparedness at a global level. I'm pleased to announce and welcome Jacqueline to give us some introductory remarks. Thank you.
Thank you so much, Rose, and thank you for this invitation. Really excited to be in the company of the most trusted profession. Like Amy has said, I work for AMREF, and I'm also representing the CSO constituency for the global health at the recently launched pandemic fund. So really excited to be here, really excited to be seeing this movement as it grows. We are struggling, I'll be honest, we are struggling with the CSO community mainly because of trying to get people to work with us in this, because at the end of the day, we want the voice of the CSOs to be heard at that level. So I think the greatest challenge for this group is really making sure that we walk the journey with all the nurses, that the nurses know that this is happening, we create a movement around that and get the commitment that we deserve. I'm here on this session today to really share some of our experiences in the COVID-19 vaccination. Like I've mentioned, I work for AMREF, and most of the work we've been doing for the last 2 or so years is around making sure that the most at risk are vaccinated. And the one thing we've realized is that we are battling many challenges at the same time. We usually have the usual challenges in the health system. We say that COVID exposed some of these challenges, but then now we are also facing a lot more challenges. And I think Amy has just mentioned, we had a drop in the number of children who are being who are immunized for the better part of 2020 and 2021. We now have more zero-dose children, and part of this is because of the challenges that we have on the health system. And therefore, even as we look ahead, we are looking at how do we plan for both the existing challenges and now the ones that we are getting due to all the emerging diseases. And I'll focus more on Africa because this is where I work. As we speak, we have about 149 events being tracked by the WHO for the Africa region. I think most of us are aware that we have, the Ebola outbreak in Uganda, for example. We have monkeypox in the West African region. We have cholera in Nigeria. We don't know what else is coming up. I think we just saw the news the other day that we also have measles in Kenya or something like that. So these challenges are here to stay. And every time something like this happens, we are reminded that pandemics happen because we've got challenges in the health system. When our health systems fail to prevent, to detect and respond to infectious diseases, that's when we have these kind of challenges. And what we've observed in most of the countries that we are working in is that there's a very strong correlation between the strength of the health system and our ability to vaccinate our children, our ability to respond to these infectious diseases, especially those that have pandemic potential. When we talk about the weaknesses on the health system, we also want to talk about the nurses because that's where we come in. And we've realized that our health workers, especially our nurses, are often a litmus test of what's going on at the community level. Anytime we have a risk, a disease threat at the community level, the people who get exposed, even before we have confirmed what's ailing our communities, are the nurses, because this is where our clients, our communities go report to first, especially at the primary healthcare level. So they are the litmus test. Unfortunately, they have very little recognition on the role that they play in detecting these diseases, in disease surveillance, in triggering the response. So they're obviously the ones that are highly exposed, but the recognition is greatly lacking in the health systems that we are working in. What we also learned during the COVID-19 response, especially in the vaccination, is that we stretched the responsibilities. I think nurses are the ones that are mainly involved in the childhood immunizations, but we did not stretch the resources that we dedicate to the vaccination programs for both the routine immunization as well as the COVID-19 vaccination program. And therefore, what we saw is that we had a very demotivated workforce. We had a lack of PPE. We had a lack of enough preparedness, especially for our healthcare workers. Some of them were not adequately trained. They were not trained on time. And because of that, we saw a lot of resistance in as far as getting vaccinated is concerned. I think in Africa, we have less than 50% of them vaccinated in COVID, which means the risk continues, especially for our healthcare workers. And because of that, we've also seen issues with the brain drain of health workers, which means we struggle more with the few healthcare workers that are left. That said, a few good things have happened. We have learned a lot during the COVID-19 response, during the vaccination programs. We've seen more technologies come in. We've seen more training of the nurses and the midwives using virtual technologies. We've seen better use of data in decision making. So it's not been all bad. A few things are looking up. And I think what we want to do is capitalize on some of the lessons that we have learned. So looking forward, what we want to do, I think the wearer of the shoe is the one who knows where it pinches. And I think one of the things we are calling for in this call is working together to ensure that we can bring to the front the issues that face us as nurses and midwives to ensure that they are addressed. And to be able to do this, we must have the right skills to advocate. I think one assumption we make is that we are ready to really speak out as one voice to really bring our issues to the forefront. But one of the things we've realized is that in most training curriculums, in our colleges, as well as when we get to work, there's very little focus on advocacy, especially for the nurses and the midwives. And yet they form about 70% of the health workforce that we have. So if we want the nurses to participate in this challenge, then we are saying let's upskill them. Let's ensure that they have the requisite skills for advocacy. Let's ensure that they have ability to use data, that they can conduct science, implementation science, they can conduct research to be able to identify the issues and be able to package them and speak out. So I think the first thing that we want to recognize is that nurses are best placed to speak out on the issues facing us, on promoting equity and access to vaccination programs. But to be able to do that, we must have the right skills for that. And that means we need to go back to our training institutions. If we must revise the curriculums, then that's what we're going to do to ensure that advocacy, use of data for decision making, use of data in generating evidence, in as far as access to vaccination services is concerned, that we have these kind of capacities. So let's review the curriculum in our training institutions, but then also let's also ensure that our health workers who are already in service, the nurses, the midwives who are already in service are supported to be the right advocates, to do it well, and to be able to use data to present their issues. The third thing is that we also want to capitalize on the investments that were made during COVID. I think some countries have done a really great job in ensuring that we have good vaccination programs. Countries like Rwanda, for example, have already vaccinated over 80% of their targeted population. And part of this is because they've used the right strategies. They've been able to provide continuous training to the healthcare workers. We've seen a lot of investments on the cold chain facilities. So a lot of good things have happened during the COVID vaccination programs that are currently ongoing. And we want to learn from that. We want to capitalize on that, and we want to integrate that in the current routine immunization program. Because at the end of the day, we want to pick the ball from where we dropped it to ensure that we can up our games in as far as routine immunization is concerned, and also be able to continuously vaccinate, especially the adult populations that we are targeting in the COVID vaccination program. And then, of course, we can't do this alone. We must recognize the role that political leadership plays in this. We do not want to fall into the same challenges as we have seen with the community health workforce, where we've been talking about this for the longest time, but we are barely seeing enough commitment from our political leaders. We are barely seeing any resource allocation to ensure that the community health workers can be paid in supporting the work that we are doing at the community level. So I think the other thing that we want political leadership in everything that we are doing. We want to see commitment. We want to see resource allocation to ensure that the nurses have the right working environment, they have the right PPE, they have the right training to be able to perform optimally. Last but not least, everything happens at the community level, at the primary healthcare level. And if we don't have enough investment at that level, it means that even our nurses are not going to have the right working conditions. They will not have the PPEs they need. They'll not be trained. They'll not be able to serve the communities better, to increase equity in access in as far as reaching the children is concerned, in as far as reaching the adult population is concerned. So even as we push for political leadership and commitment, we want to say, let's invest where it matters most. And that's at the primary healthcare level, to ensure that we can benefit from the investments that have been made from the COVID-19 vaccination program, as well as continuously improve our vaccination programs. So I want to congratulate the nurses that are making this commitment today. I really want to encourage you to reach out to the others, because the more we are, the better our voice is going to be heard. And I also want to encourage the partners, the stakeholders that we have, to strengthen capacity of these nurses to be able to speak out, to generate evidence, to be able to have really strong cases, even as they present their position as the nurses and the midwives who want to ensure equity in access to the vaccination program. Thank you very much.
Thank you so much, Jacqueline. You've highlighted a number of issues. You have told us about how nurses and midwives are litmus test for how the health system works. And if they fail in detecting and responding, that's how we see epidemics grow to pandemics. But also you have lent us a voice on how the African continent, which is battling with multiple epidemics and pandemics at the same time, is faring. At the same time, you have highlighted the interconnectedness of the health system building block, governance, workers, the health financing, the medicine, the information, and the health service delivery. And no component can survive at its own. They are all interconnected. And therefore, at the forefront of it all, we want to be able to see the health system as a whole and not in its parts. But we cannot handle the issues that the health systems are facing, whether it's at the grassroots, at the national level, at the global level, without advocacy that highlights the issues that the healthcare workers are facing or their populations are facing and points them to the decision makers. So allow me to welcome being Vice Minister Blazer, who's a good friend and whose organization in collaboration with Nursing Now have been a major engine of support. Immunization Advocates and us to do so smoothly. We thank you so much, Vince, and we welcome you to moderate the session, the panel discussion with the Immunization Advocates and Jacqueline. Thank you.
Thank you so much, Rose, and it's great to be with you all again. And wow, yeah, it's just a great set of talks so far. And yes, I'm here to moderate a session with all of these amazing immunization advocacy champions, as well as Jackie. We're going to talk a little bit more about the current situation that we talked a little bit, that has been talked about a little bit so far, of the kind of current state of COVID vaccine rollout alongside this 30-year sustained decline in routine immunization, the 30-year low, the longest sustained decline in 30 years in routine immunization, and kind of what nurses and midwives especially can do about that in the advocacy world in particular. And so maybe I'll first go back to Jackie just with something that she ended with there. Jackie, you spoke a lot about the importance of investment in primary healthcare at the end, and could you just say a little bit more about why that greater investment in primary healthcare in particular is important in the immunization world, and then in your work in advocacy and policy, how and why has it been important for health workers to show that bravery to share their own experiences directly with those who are making these decisions in the political world?
Primary healthcare, because that's where most of us go for very basic and essential health services, and that includes childhood immunization. I think in most places in the world, especially in the global south, that's where mothers will typically go for their ANC, their antenatal clinics, for their maternal health, for childhood care and everything, for the immunization. And now we have the adult immunization, which is not very popular, but has to be integrated in the usual health system. And when we talk about this, then we're not talking about clinical level, we're talking about primary health care. So that's an add-on at the primary health care. We already had quite a number of challenges at that level, very little recognition. And I think I also want to highlight, which is quite shocking actually, because for example, Africa CDC, which is coordinating most of the work that we are doing as a region, especially in enhancing health security, when we talk about strengthening the capacity of the health workforce, we are seeing a lot of focus on the public health epidemiologists like us, on the lab technologists to strengthen diagnostic capacity. But there is absolutely no mention of nurses. And yet we know that anytime we have an emergency response, it is the nurse who provides the care to the client. It is the nurse who is immunizing. But when we talk about health security, we barely have any mention of the nurse and the role that they're going to play, including disease surveillance, because anytime you have a rise in the number of cases that are reporting with certain conditions or symptoms, it is the nurse who's going to identify this first. And yet we are not bothered at all to even train them to ensure that they are alert in as far as disease surveillance is concerned, that they can trigger a response when that happens and understand their role, including protecting themselves. Because most often than not, they know how to protect themselves once the training comes in. How can we ensure that they are ever ready? They protect themselves even when we're not sure about what's going to happen, because the numbers are already so low. So imagine losing any of them. I think in Uganda, we've already lost about 4 healthcare workers right now in a disease that was identified not more than 3 months ago. So you don't want to imagine what's going to happen every time we have a health emergency. We have over 100 of them going on right now. So imagine if we lost healthcare workers every time we had an emergency, that the number continues going down because of the brain drain that we are seeing right now. The situation is going to get really, really bad. So if any investment has to be made, primary healthcare, let's increase the number of healthcare workers we have there, because what happened is that we stretched the ones that were there. The same nurses who provide the routine are the same ones we told, hey, can you up your game and go out and provide the outreach services for the adult vaccination program? You know, it's the same nurse who thereafter is supposed to come back and ensure that the children are vaccinated. And therefore, it was inevitable that we were going to have a drop in the number of children that are accessing their immunization. When we go for the outreaches, most of the time it's for the adults. It's only recently that we've started integrating this to ensure that every time we go for the outreach, we are reaching out to the children, and we're also looking at the adult population. So the stretch is what caused the drop in the number of children that were accessing the vaccine, because we relied on the same healthcare workers. We did not employ anymore. We did not increase the resources. If anything, we use the cold chain infrastructure, the supply chain infrastructure to expand onto the COVID-19. And therefore, if we have to do better next time, then it means let's invest where the services are needed most, and that is the primary healthcare. And in that, we look at all the different building blocks, especially the healthcare workers. And we all know, especially in the African region, when we talk about primary healthcare, then we're talking about the nurses, and we're also talking about the clinical officers. So if we must improve the capacity there, then we're talking about the nurses as well as the clinical officers.
Thanks, Jackie. And I think you hit on a couple of points that are really important in terms of what health workers' voices can do and what needs to still be done. If you look at, you had talked about Africa CDC having indicators just for doctors. So there's an advocacy kind of push that's needed right there. As we need to have that inclusion. I put in a link there, the Global Health Security Agenda, that it's 50 some country agenda that kind of started before. It started in 2014. It started before COVID pandemic. But in that, there is a action package for health workers, but is the numerical targets for that target are only including epidemiologists and veterinarians. Obviously, those cadres of health workers are important for disease surveillance. But we all know, as you say, nurses, midwives, community health workers, other community physicians and others that are on the front lines. Those are the first folks who detect and respond to diseases, and so there's a need for that continued push to include. At the same time, there's this great momentum that folks like this group and others have created. And I know just last month at the UN General Assembly that some of these folks were presenting. There was an announcement of the new Global Fund Catalytic Fund, initial $50 million for a frontline health workforce through Africa Frontline First. So there's momentum there, but I think Jackie really hit on the point as you take those initial points, and then you really need to kind of can then look at what the policies are in your region and your country, and work with other advocates that are working on that. And so with that, I'm gonna, there was a question from, one of the questions from one of the group, one of the participants was on this question of the reasons for decline for COVID vaccinations. And the question was, is the decline of children vaccinations due to restrictions with COVID-19 or reluctance to take the vaccines? I know that I talked to a lot of you about this, but I know, Rafiat, you've had some experiences in particular on this question. So wondering if you could share just a little bit about your experiences in talking to your community about this.
Okay, thank you very much, Bean. I think it's both ways. Because when we talk about this challenge, we have to also talk about the peculiarity and what happens in various local communities in different countries. So I'll be talking about my experience and my perspective as a community health nurse from Nigeria. So it's both ways, because firstly, majority of our resources were directed towards COVID-19 vaccination. And usually in the community, what people talk about is COVID-19 vaccination. And then there is a little bit of neglect in childhood immunization. For instance, if you go to various immunization clinics, what you have to see is a lot of people queuing to get their COVID-19 vaccination, and very little efforts or very little attention is given to normal routine childhood immunization. And so this has caused a lot of imbalance in both ways. So when you look at it, a lot of people, parents, when they come for their clinic visits, they feel so frustrated to the extent that, when there's a whole lot of people out there and they are not able to meet up with their vaccination visits and are asked to come back for like another day for another visit, this causes like a lot of unwillingness on the part of the parent to come back to the clinic and get their child vaccinated. So a lot has been done. A lot has been on the major cause of shifting the attention of primary healthcare workers and community healthcare workers to the COVID-19 vaccination at the expense of childhood immunization. Secondly, Nigeria tackles a whole lot of challenges with vaccine hesitancy. And even with the COVID-19 vaccination, there has been a whole lot of myth and misinformation about the COVID-19 or vaccines in general being a way of reducing the lifespan of population or being a way of killing people. In fact, as a first-hand experience, I had been able to witness a sermon whereby the religious leader was talking about vaccination as a way of reducing the lifespan of the population. This is another challenge that we are currently facing in Nigeria. There is a whole lot of vaccine misinformation going around, which has been on the rise since the advent of the COVID-19 vaccine. And this has affected the acceptance of other childhood immunization. People are now reluctant to come in for childhood immunization. And then this has caused a whole lot of backdrop in people's acceptance of routine immunization and even childhood immunization. So I think this has been my major experience as a community health worker. And then another thing has to be the shortage of healthcare workers that we are facing in Nigeria. A lot of frontline healthcare workers are going out of Nigeria into other countries, and there's a whole lot of shortage. Already Nigeria has been facing a high level of it's an epidemic right now, a high level of shortage of healthcare workers, including community healthcare workers, and you have very few nurses trying to vaccinate a larger population. Currently, Nigeria is overpopulated, and we have just few healthcare workers on the front line to actually vaccinate a larger population of people. This has caused a whole lot of strain in actually accepting and even coming for immunization and routine immunization clinics. So this has been my first-hand experience as a frontline nurse from Nigeria. Thank you.
Thanks, Rafiat. And I know on that last point, I know that you were just quoted in a story about the migration issue and and of course it's always a challenge, but it's as you say, especially acute challenge right now as this pandemic has gone on. I'm going to turn to Rose off of your point about, Rose, I know that you have been working on some of the COVID vaccine outreach, doing so amid, as Rafael was describing, a very stretched health workforce, and we know now that to a certain degree that COVID-19 is here to stay with us, and so there's a lot of current discussion in public health circles about how you do or don't integrate the COVID-19 vaccine rollouts with some of the other immunization programs. Can you talk about some of the challenges that you've seen in how that operationally can work, especially in remote communities that you've been serving in Uganda?
Yes, thank you, Vince. Yes, I do wear a number of hats, and I can talk about that as consultant, regional program coordinator for FHI 360. I think for me, my first-hand experience has been that in rolling out of COVID-19 immunization, reaching remote populations and how to reach populations or islands require different strategies from populations in the urban areas, because whether you have to use door-to-door immunizations, whether you are going to do outreaches, the country campaign mode. And campaign modes have to be highly funded. What about a country like Uganda, where I work, is facing another potential of a pandemic like Ebola? The country now focus on multiple diseases to be able to combat them at the same time. So whatever, there is no one disease which is a priority at the time. It's about ensuring population healthy at that time. So in that the force is still, it's not infinite. It's still a small healthcare workforce to the population that it has to care for. So all partners are right now trying to figure out how do we integrate COVID-19 into existing routine immunization. But this comes at a challenge because the staffing issues. If you are going to integrate COVID-19 into it, the numbers that are coming up for vaccination at young child clinics are going to increase at these static sites. But as they increase in number, if they increase in number, the chances of spreading other potential epidemics because of the contact they're having at each other. So the standard operating procedures that have to be in place have to be heightened. Now, who does this this monitoring and everything? It's supposed to be still the nurses and the midwives who are supposed to be in charge of all this, but yeah, it's more stuff. So the population is also left in a scare, and that's the COVID-19, the populations were left in the scare for turning up at hospitals because they were thinking they were the centers of the disease. Right now in Uganda, the recent death of Ebola is a patient who ran away from a hospital to a witch doctor. And the patient had believed that the hospital was the one going to cause him his death. So when the places where we're supposed to, the static sites are supposed to be the sites where now potential integration of COVID-19 vaccination into routine vaccination happens. But also as you think of the larger ball, health financing, because prior to that, what deterred the population from seeking vaccination were recent stockouts of vaccines, and currently right now there is increased awareness about the mix and match of COVID-19 vaccination, but that at a certain time before, it was deterring the populace from seeking vaccination. And so these are issues that have to be looked at as a whole. How do we increase the health financing? How do we increase the health? How do we ensure that the population will for these vaccines, and ensure that the hospital sites are not a source of scare, but rather a source of healing, as they've always been, and ensuring continued commitment of all the partners that are supporting the COVID-19 vaccination, but also the other of the health system, that they continue to support the financing of these vaccines, so that we don't see the stockouts. Thank you.
Thanks, Rose. And I think you hit on a really a strong point of that trust in the health workforce, especially when in terms of as a decision like vaccination takes time to develop those relationships, right? And to have the conversations. And so, you know, that investment, when we're talking about investment in health workers, is both in the time they need to be able to do it, as well as the equipment and the support and everything else they need. And I think that that's a good segue to bring in Rashid Manganda. And Rashid, I know you're coming on late, coming off your shift there, but I want to bring you in on this point, because we're talking about some of the reasons of downturn in childhood vaccination, and if it was from the pandemic or other reasons. And I know that you spoke a lot at the UN General Assembly about that with COVID vaccinations, you're largely trying to immunize more of the adult population, which don't receive some of the typical EPI immunization program services. And so that you've had to take this more direct one-on-one tactic with them. And so just wondering if you could share a little bit more about that, and your feelings about how the COVID program should continue either integrating with some of the other vaccinations, or it needs to be kind of a separate separate discussion with communities. So Rashida, over to you.
All right, thank you so much, Vince. First of all, I want to concur with Rose that integrating COVID-19 vaccines with routine immunization is going to be a challenge, especially in our communities here in Malawi. The first reason is people are still not trusting COVID-19 vaccines. So if we integrate COVID-19 vaccines, we have the potential of declining the routine immunization. I've seen this, I've experienced this, I've observed this here in Malawi, where we started integrating this COVID-19 vaccine into routine immunization. Then we hello, can you hear me? Yeah, we observed the reduced number of women coming with their children to receive routine immunization. So the approach that we are using in delivering COVID-19 vaccines, I think it is very difficult to use it when combining COVID-19 vaccine immunization. Because I have observed that we are able to vaccinate a good number of people when we are reaching when we deliver the vaccine one to one. Yeah. So with routine immunization, it's like we are having a large number of people, and we're trying to give them information and give them the vaccine. This approach they don't understand well. So I think integrating the routine immunization and COVID-19 vaccine is going to be a challenge. And for now, I think we need to treat it separately. Otherwise, we are going to collapse the routine immunization. And the other issue is that of infrastructures. The infrastructure that we are using in delivering routine immunization are limited here in Malawi. So when we combine with routine immunization, we need to have additional structures where we can be able to deliver COVID-19 vaccines. Because if we are to deliver in the same room or at the same place, COVID-19 vaccine and the routine immunization, with the mistrust that we have, we are likely to have a low number of people coming to get the vaccine. In terms of human resource, I don't think we can have the problem here in Malawi, because the same people that are delivering routine immunization, they're also responsible in delivering COVID-19 vaccine. So in terms of human resource, I don't think we can have a problem.
Thanks, Rashid. Yeah, really interesting insights. And I think, presenting that challenge in some settings, it could look that there can be, certainly integration of services needs to take place wherever it makes sense. But as you pointed out, in some element, there's different elements to the COVID program that may need to remain separate in some fashion. And I think it's going to be really important, because a lot of governments are discussing these policies in the next couple of years as this some of the emergency phase of the pandemic ends in terms of government policy. So it'll be really interesting to continue and necessary to continue to share those experiences. I want to turn to Amy, and maybe Amy, to pick up off of something that Rafiat was talking about. Rafiat was talking about some of the rumors and misinformation that are circulating, and some of the impact of some of that misinformation for COVID vaccinations on routine immunizations. I know that you've really taken part in a lot of leadership discussions in the last couple of years. Just interested in your thoughts on the importance, especially of nurses and midwives being the ones who are more directly hearing about what communities are talking about, and the importance of directly sharing those with policymakers and the impact that can have.
Absolutely. Thanks so much. I will say, I agree with you. It's no longer a pandemic. Now we have the other elephant in the room, which is the infodemic and the spread of misinformation. And I think that the solution to this is going into these communities, meeting people where they are, having these discussions with our patients and our neighbors. It doesn't have to be in the hospital. It can be at the barber shop in your town. It can be at a restaurant while you're waiting to pick something up. You can have these discussions anywhere. And one thing that I learned when I attend the UNGA with you and with Jacqueline is that there's many people in these powerful positions, and politicians and presidents and CEOs, and they do want to help nurses. They just don't know how. And that's what we need to share with them. And we need representatives from underserved communities who aren't usually heard. We need to bring them to the forefront. We need to hear from nurses on the front lines here in New York, nurses who've been treating COVID patients since 2020 and still are. We need to hear from nurses like Rashid, who we just heard from, and Malawi, who traveling by foot hours per day. Nurses like Mapo, one of our other champions.
Amy, I think if you can hear us, I think your screen is frozen a little bit there. So if you can hear, I'm going to actually turn it over to Mohammed. And Mohammed, maybe you can close out our panel here by talking. I know that you have talked a lot about that the importance, especially as we're going forward, we're talking about a major issue of millions of children at risk here every year, on top of the issue of the COVID-19 pandemic with this decline in immunization. And I know that you've talked a lot about the importance of EPI programs, of the immunization programs in particular, elevating and investing in nursing leadership and having nurses in leadership of those programs. Can you talk a little bit about why you think that's really important and maybe related to some of your experiences in recent months in Sudan?
Thanks so much, Ben. When we are talking about declining in routine childhood immunization, COVID-19 pandemic, as all you know that COVID-19 pandemic has made a huge impact on daily basis rather than other PHC programs, especially in routine immunization. COVID-19 showed us the importance of investment of nurses to be at the place that are providing routine childhood immunization. Because when we are talking about achieving a routine childhood immunization, that you are definitely are talking about, you need a greater number of healthcare workers to vaccinate those children at different situational levels. In my case, recently in my country, nurses they are not a part of COVID-19 program, neither the immunization program. The vaccination program has been rolling out and administered by health promoters. When COVID-19 pandemic comes, so the API program are using both the same system, are using same system for immunization. Because when we are talking about achieving a greater number of COVID-19 vaccination and at the same time maintaining API program, you need a well-trained healthcare workforce. So COVID-19 pandemic has put an extra burden on exhausted EPI program, so it has impacted the quality and the number of area of childhood routine immunization has been achieved. So taking into consideration investment of nurses to be at position of delivering routine immunization of COVID-19 pandemic is an essential point, and it must be done during current time, because we have a huge number of nurses that are not working in the primary healthcare, just they are working at clinical care. Now COVID-19 pandemic showing us prevention is better than cure. So when those nurses has been placed as the primary healthcare centers, as the nearest healthcare facilities, when they have been placed to run such EPI program, so at that time they will increase the number of COVID-19, the number of routine immunization vaccination, and in turn we will receive a huge number of immunization at different children. What I need it right now immediately, because when we are talking about vaccination itself, despite the fact its cost effectiveness, it protects the population, also it reduces the burden of sophisticated or weak health system. Because when you immunize a child, you are preventing them from getting illness, and at the same time you are preventing the number of money that are being wasted for many of those piles. So investment of nurses is a critical point for current now for all leaders and all education try to think about nurses, importance of placing nurses in primary healthcare facilities and provide capacity for those nurses and train them on how to deliver vaccination properly. Adding to that, supporting them and adopt these measures for future investment, because it's when we have strong primary healthcare led by nurses, that in turn will impact our health system. Also, as all global leaders agreed on a standard declaration that primary health care should be led by nurses, is this the time now to start the process of endorsement of nurses at BHC level as various programs to have more greater involvement and more greater protection in our local community. Thank you again.
Thank you, Mohammed. And I think that's a good point to end on. I'm happy to take in a few questions before we close out, but I think, but just to reiterate your point, there was a study done that's in the Lancet for the impact that vaccinations had in vaccines that were already delivered in the previous decade, 2011 to 2020. That's estimated to save, and these are just 10 childhood vaccinations, that's estimated to save at least 50 million lives. So 50 million lives were saved for the vaccinations that health workers delivered just in low and middle income countries in the last decade. The first year of the COVID vaccine rollout, we all know the stark inequities of that rollout, and that millions more could have been saved if there was an equitable rollout. But nevertheless, it did save nearly 20 million lives in its first year of a COVID vaccine rollout. Health workers delivered the largest vaccine rollout in human history, the COVID vaccine rollout at the same time as trying to keep up all of these routine immunizations. We talked about there is the 30-year, the largest sustained decline in 30 years. It is, this is after years and years and years of increase, right? So is up, the last decade has been a bit more flat. We talked about this in a previous webinar. It's in the low 80% for one of the main vaccinations, DTP3, that is tracked, and then there's been a dip down. But there, as Jackie was talking about, some countries have had some very strong success in getting in restoring that immunization. And I think it's those that have really focused on the people and the systems that are needed to deliver, right? And so I think we've talked about some of these elements that policymakers need to hear from today. And I think as some of these programs evolve, it's going to be extremely important for health workers to continue to, both at the subnational level, at the national level, at the global level, talking about these investments that are needed, talking about the policy changes that are needed. It does seem like there's probably going to be some policy elements that in terms of the scope of practice of different health workers, in terms of where there needs to be the focus in the vaccination programs. And so it's your experiences and your voices that are going to have the greatest impact in terms of the ability for these children and these adults to receive the full benefits of vaccination. So with that, I'm going to hand it back off to Mohammed, who I think is going to close us out. So Mohammed, back over to you.
So thank you so much, Vince, for elaborating on such an important manner. As you said, when we talk about declining of routine immunization, it suddenly occurred despite the huge impact has been done by the healthcare workers in the past year. So when we are going to talk about the role of nurses and the voice of nurses to address the issue of COVID-19 vaccination, other routine immunization, I think this is the right time for now to all nurses to get involved and to advocate for more involvement of nurses in the COVID-19 vaccination, other routine childhood immunization. That advocacy began in such a manner, began by raising your voice at your unit at various hospital level and try to get involved in routine immunization advocacy from your own person, from own perspective, and also put a great burden on the educators who are guiding nurses to instruct them that not only they are the clinicians that were working in hospitals, but also they are ones that was delivering EPI program. I remember well when before I applied for the Global Solution Initiative, when I realized that my voice is matter. When I raised my voice, talk to my fellow nurses about the importance of addressing the issue of COVID-19 vaccination at my own clinic. Then the opportunity has come through Nursing Naturality and Saving Vaccine Institute to get more funding, to get more training, to get more capacity building in order to deliver a message by appropriate way. Then a group of nurses from different backgrounds, from different countries come together and receive an online training with People Power Health. They build their capacities in the storytelling and the importance of the storytelling when we talk about COVID-19 vaccination. Also, when we're training healthcare workers, also when we are addressing our local communities, and we learn a lot through that period of time. Then the group has discussed and shared various challenges and various backgrounds regarding tackling the COVID-19 vaccination from their own perspective. Now the time is come again for all of you in the room to join this important matter, join this new global initiative, and by applying for this. We encourage all of you to get involved on the application process. Will be shared by Nursing Now Challenge team later, and try to come with your own innovative idea to increase the voice and advocate for the voice of nurses at EPI program, even at COVID-19. Regardless, if you are thinking even about just an idea that will make a change, try to apply and don't miss out. We are a group representing 8 countries. We are remaining more than 182 countries. Who knows that your idea that will come. I'm pretty sure that Nursing Now Challenge and Saving Vaccine Institute will offer you the place that your voice will be here. This will be granted that your voice will be here at the highest level. When we apply for this, no one of us shows that he will be talking about in UNJ. No one of us is talking, he will be talking, his voice will be heard at White House. Even no one of us is saying that his voice will be heard by policymakers at World Innovation Summit for Health, or even that the work that we are doing will be impacted and will be encourage and motivate our nurses from different backgrounds to work on it. So applying for Nursing Now Challenge Global Solution Initiative and Saving Vaccine Institute will give you the opportunity to grow up and implement your main idea at your local community. Also will allow you to share your experience with other nurses from different backgrounds, or also will offer you a place that your voice will be heard at the highest level of policy making.
Thank you, Muhammad. I think it's now 2 minutes past the time that we had to end. We thank you so much, everyone. We thank my fellow immunization advocacy champions. Thank you to Vince Blazer and Jacqueline for joining. And thank you so much, everyone who has joined us. We encourage you to register for the challenge and participate in the challenge. But for now, we say goodbye and thank you for joining. Bye.